Good evening. Welcome to the San Francisco Campus for Jewish Living. I am so excited to see everyone here tonight. I am Adrienne Green. I am the CEO for San Francisco Campus for Jewish Living. It is such a privilege to be here with you tonight. San Francisco Campus for Jewish Living is a place where we embrace aging, all of the beautiful parts of it and all of the challenges. And we're very privileged tonight to have Dr. Carla Persinotto here to address and help us better understand one of those challenges. I've been privileged to work with Carla for many years, and I know that you will enjoy her presentation and you will leave with new ideas and thinking related to social connection and medicine. I know there are some of you who have spent a lot of time here, but there are also others in the audience who this may be the first time that you are coming to the San Francisco Campus for Jewish Living. So I just want to share with you a little bit about what we do here. So we offer a comprehensive continuum of care for older adults. We have the Frank Residences, which is where we are right now. It's a state-of-the-art assisted living and memory care. And we have the Jewish Home and Rehabilitation Center, where we care for patients who are coming out of the hospital in our short-term rehabilitation center. We have long-term skilled nursing care, and then we have a small, very specialized acute geriatric psychiatry unit. On any given day, we have over 500 patients and residents here on our campus, and over the course of a year, we care for over 2,500 patients and residents. Tonight's event is the third and final event in our second annual speaker series. We've entitled our speaker series, Reimagining How We Age. And each of our sessions closely align with our organizational values of community, compassion, and excellence. And we work really hard to come up with topics and speakers to present things that are highly relevant to older adults and their families. There's a Jewish proverb that states, "A sorrow shared is a sorrow halved." And this reflects the importance of community and connection, really emphasizing that some of the challenges that we confront, particularly loneliness and isolation, can be lessened when people come together. And this very much aligns with our belief here that shared experiences in community, whether they're meals or conversations or programs like this one, are very essential to every person's well-being. We're also very, very grateful to be able to bring subject matter experts like Carla here to San Francisco Campus for Jewish Living. It allows us to really explore the science of aging and to think about innovative ways to provide care. Dr. Carla Persinotto is an experienced geriatrician, and her research has focused on the impact of loneliness and isolation in older adults. She's a professor of medicine in the Division of Geriatrics at UCSF, and she's a home-based primary care physician and palliative care physician with Get Aging and Sabio Health, which she founded. Her research and advocacy have focused on integration of loneliness assessments in healthcare and evaluation and implementation of community-based programs focused on ameliorating loneliness and isolation. Carla is going to be sharing a short presentation that will be followed by a conversation with Stacy Lewis, our Chief Development Officer, and then we'll have some time for Q&A. And then afterwards, we hope that you will stick around for conversation with each other, with Carla, and we'll have some food for everyone after the event. So with that, please join me in a warm welcome for Dr. Carla Persinotto.
Thanks so much. I'll start by saying my presentation is short-ish because this is a topic that's really near and dear to my heart. And it's hard to really sum up over a decade of research that I've done into something that can be relatable and that you can all hear. I titled it Social Connection is Medicine because I think, just as Adrienne said in the Jewish tradition, connection is really the core of who we are. And it's actually incredibly impactful and important to our health. We're going to start with talking about framing and definitions of what we're talking about. We'll talk about individual and collective approaches to thinking about and addressing loneliness, and then we'll talk about examples from our community. But before we do that, I think it's really important to stop and just remember that we're all welcome. There's a lot of dialogue in the country going on right now, making some feel unwelcomed, and that is the antithesis of what we should be doing as community members. And so regardless of what your faith tradition is, regardless of how you define yourself, it is important that we all create space for one another. So I'm going to start with a personal story. I have the privilege of having my mother here in the audience, who was born in Mexico. My father was born in Italy. And what that means for me as I think about my own personal connections and my own social connections is that how I form the structure of my community is that it's really cross-national and international. I had the privilege of going to Spain and France this September to celebrate my 10th wedding anniversary. And as I joke with my husband, I went with my mom and my daughter and invited my husband. And that is the structure, but it also refines or helps me think about the function of relationships, that by having my mom, I had a historical perspective and cultural background that frames how I form connections. I have the bonds with my daughter and the bonds with my husband who supports me through difficult times. And then the quality of relationships, which is how can we maintain those relationships through thin and thick? And how do you sustain each other, whether that's with a friend, whether it's with your extended community where you live, or whether it's with a partner. If I think back in time, I started medical school in 2001, and I can guarantee you that when I was in medical school, no one talked about social connection. No one talked about loneliness or isolation and how it impacted the people that I was seeing every day. But interestingly, it was actually in 2002, a year into my medical school training, that the first article looking at loneliness and health was published. This was not in the medical literature, however. Fast forward several years, and in 2013, we start seeing articles in the press, loneliness is deadly. And then in 2018, is there an epidemic of loneliness? We fast forward to 2024, where Silicon Valley or San Mateo County declares loneliness a public health emergency. So this is really over 20 years that this research has been going on to really discuss loneliness and isolation as a public health issue. And we'll talk about what the literature says about that and why we're calling this a public health issue and why I'm saying social connection is medicine. And then just this month in The Atlantic, there's an entire publication talking about
the antisocial century and how did we get to the place that we were in now.
One of my favorite poets, Rupi Kaur, she says, "The irony of loneliness is we all feel it at the same time together." So what do we mean by these definitions? So loneliness is really the subjective feeling that someone may have. It's the discrepancy between the relationships that you actually have and those that you wish you had. So there's a distress that happens when it's not what you want to be in. Okay, or there's something missing. Social isolation, in contrast, is actually an objective measure of the number of relationships or types of relationships you have. These can overlap, they can coexist, but they are not the same thing. And it's important to know that because how we address it may be different. So we are all here in community, but that doesn't mean that any one of us isn't feeling lonely, right? On the opposite side, there could be people that are living alone and don't feel lonely at all. And so it's a continuum. When we fast forward to the Surgeon General talking about loneliness as a public health emergency also, he defines 3 main components for social connection, which is how I started talking about my personal experience. What is the structure of relationships, which could be your household size, your friend circle size, whether you're married or partnered. Then there's the function. What types of relationships do you have and what are they doing for you? Do you have people that are providing you emotional support? Or is it just people that are not just, but is it people that are helping you with everyday tasks, but in a crisis or when you're feeling down, you don't have anyone to turn to, or you do? And then lastly, the quality of relationships. Are you satisfied with the relationship that you have? Are you married but there's relationship strain? Are you excluded from a group because of who you are and how you define yourself? So those are the three components. When we talk about measurement, this is like a beautiful research slide that tells you it is very complicated how we measure all this stuff. We are having a hard time nationally coming up with consensus about how we measure. However, I will share where there is some consensus and where my bias is that there is a scale called the UCLA Loneliness Scale, which asks three
Questions. Do you feel left out? Do you feel isolated? Or do
do you lack companionship? The more often you feel these things, that's where we start to define loneliness. Why are we talking about this as a public health problem and something matters to our health? And why am I here talking to you all? It's because in research that I did back in 2012, 43% of adults over the age of 60 reported some degree of loneliness. So that is not insignificant. 1 in 4 report isolation. And then teens and young adults, 73%. Okay? And that is why when we think about how we define epidemics, that is why our former Surgeon General defined this as an epidemic. That is why San Mateo defined this as an epidemic, is because an epidemic is something that affects or tends to affect a disproportionately large number of individuals. And when you're looking at prevalence rates as high as 40%, 73%, that is a significant number of people. And in many ways, loneliness and isolation is age agnostic. The health effects certainly get magnified as we get older, but this can affect any of us at any age. So what are the risk factors for loneliness and isolation? Losses, whether that's the loss of a spouse, the loss of a community, the loss of identity, the loss of hearing. Those are all different things can affect us. Marginalization, and why there's great concern about what's happening nationally, internationally, as we start to marginalize more groups of people. If you look at trends in the US about what is going on, these are lots of graphs, but what you can see, the trend in all of them, is that they're all going down except for one. The one that's going up is social isolation. The rest of the graphs are saying decreased hours and time spent with family, with friends, with loved ones across the board.
So this is not something that happened just because of the pandemic,
but rather global trends and national trends that have been going on. And date back to, if anyone's read Robert Putnam's book, Bowling Alone, these are things that we've seen in terms of the social fabric of our cultures and our societies and how we engage with others. You know, before my father passed away in 2018, he had a sailing club, he had a lunch club, he had cars and coffee, he had, a million different clubs that he belonged to. Nowadays, my husband and I maybe see friends a couple times a year, practically, it feels. And so you start to see these changes happening in very short generational changes. So what are the health effects again, and why are we talking about this today as being a part of medicine? So this research started for me when I was a resident at UCSF in 2008, actually. I'm a little bit of a slow publisher, so it took me a couple years to get the data out and published. But what I was interested in is seeing people in my own community. I was working on the wards in the hospitals. I saw some of my older adult patients, some who did very well, and some who died quicker or had more loss of independence. And I was wondering, what is going on with people that we may not be asking about? And so what we did is used something called the Health and Retirement Study, which is a national representative study of adults across the United States, and we followed people for 6 years. And what we found is that adults who reported any degree of loneliness, not just severe loneliness, but that meant some of the time they may have felt isolated or they may have felt alone, there was an increased risk of death, 45% increased risk of death, and a 59% risk of loss of independence, or meaning more troubles with activities of daily living. So if you remember, I started by saying the first paper on health effects of loneliness was published in 2002 My paper was published in 2012, so a decade later, but mine was the first in a medical journal. And so it started to get the dialogue more in the medical community about this isn't something that we can ignore because it's affecting all of our health. And what also happened around this time is that this wasn't really accepted. There was this assumption that it's not anything different, it's just depression. But in fact, it's very different from depression. It can coexist, but they are different experiences. Fast forward further, and one of my amazing colleagues with whom I do a great amount of research, Dr. Coatwall did a study as a palliative care doctor looking at the rates of medication use. And what Dr. Coatwall found is that people who reported some degree of loneliness also had higher rates of pain, anxiety, depression, and insomnia. What does that turn to when you go to the doctor? More medications, right? And very
Often when I see people, not all the time, but people want to be off
medications and be on fewer. So this tells us again that there's a correlation with health, and there's an idea of what else should we be doing about this. I can quote you studies after studies after studies about the evidence here, but the summary is if you think about any major health condition that affects us as we age or at any age, heart disease, diabetes, sleep, depression, frailty, dementia, it is associated with loneliness and or isolation depending on how we measure it. And we also know that this results in higher healthcare costs. $6.7 billion in Medicare funding annually. Not insignificant. I will also tell you that the research in this area is currently threatened because some of the political things going on. I have a 5-year research grant with the CDC that I do not know will continue to be funded. So this is real in terms of understanding how this affects all of us and for potentially marginalized communities. One of my favorite colleagues, Julianne Holt-Lundstedt, who's also been huge in this research space, she was also one of the first to start sounding the alarm and said, if you actually look at the literature in terms of the magnitude of the health effects, experiencing isolation and or loneliness is the same as smoking 15 cigarettes a day. Yet are we spending the public health dollars, are we spending time in our medical communities to really talk about this as a public health issue? Probably not. There, of course, are arguments whether I, as the physician, should be addressing this, fair question, but regardless of whether it's me or other people who should be addressing this, it is affecting our health, and that's the really important take-home point. We also know that while 2/3 of people recognize that isolation affects health and loneliness, this was a study done during the pandemic by AARP showing that only 13% of people had their medical community ask them about their experience of isolation. Okay, so this is not uncommon, the experience, yet it's not being addressed. So this gets us to this question of should we even be solving loneliness, right? It's such an issue, shouldn't we just fix it and make it all go away? Well, if you talk to Silicon Valley and anyone developing an app, the question is yes, everyone wants to put money into this, and I get calls every week saying, I have the solution, I'm going to fix it all, it's with AI.
and then you create your AI companion, and your AI companion can talk to your
Mom's AI companion. I'm like, can I just call my mom? I don't need to do it through my AI companion. So there's different things. Everyone wants to solve this. But if you actually think about evolutionarily, there's some interesting things here. And ultimately, as a geriatrician, what I try to think about on this graph, you think about this graph being on the tall axis is performance. Are you independent and how are you functioning in society? And on the bottom window, it's time. And ultimately, most people want to stay as functional as possible, as long as possible. And my job is to try to change or to not let people fall into areas of frailty or disability and to try to delay that from happening. And one of those things is by understanding what's happening in someone's social circles and milieu. When you look at evolution, the idea of trying to stick with your tribe and to form bonds has actually had a very important evolutionary advantage, right? You keep your children close, you protect yourselves as part of a group, you can cooperate with hunting and gathering. There's a real purpose for this in terms of setting your community close. But at the same time, evolutionarily, there's also this point of someone sometimes needing to take a risk and go outside of the tribe, right? I think about the fact that my my grandparents from Italy left Italy to come to the United States to find a better community for the family. That is in some ways taking the stress and expanding your circle. So there's this constant tension. This week with all this disarray, I had this, this very felt primal innate need to just want to be with my family close and ignore everyone else. And another part of me wanting to shout at the top of my lungs to change what's going on in the world. And so how do we balance those things? And so the idea is that loneliness, or when we feel isolated, can actually be very activating and helpful to remind us to connect with others. But if it becomes maladaptive, where we're feeling so terribly that we can't move because of that, that's when it starts to affect our health. It's also this regulatory loop. I feel lonely, or I perceive that I'm isolated, so I become hypervigilant to people neglecting me or not responding to my text messages or not calling me. That makes me feel worse, and I say, yep, that's true. See, no one likes me, I'm ignored, my children hate me, whatever it might be, and it becomes this cycle. And that's where it becomes problematic, and that's where the health effects start to happen. So it's this stress response that we get, which leads to this inflammatory response in our body, and that inflammatory response is what we believe is behind physiologically what's happening in our bodies. It's a constant wear and tear on our body. If you don't believe me tonight and you can't sleep tonight, you can read these very long reports. One of them from the National Academy of Sciences, Medicine, and Engineering, published in 2020, of which I was one of
The committee members, really talks about the summary of the evidence. And then again,
in 2023, Dr. Vivek Murthy really talking about the evidence of why this needs to be considered, not just in older adults, but in many generations. I published a paper with my colleague Julianne Holt-Lundstedt in 2023 talking about if medical community is going to be taking this seriously, we need to have a framework. And the first part is educating, and that's really why it's so great to be here with all of you, is reminding that all of us, whether we're experiencing this ourselves or whether we're worried about as community members, recognizing that social connection is vital to our health. The second step is assessing, and the third part is responding. And when I think about responding, this can be what we would call social prescriptions. But I think it's important to remember that when you're responding, it doesn't always have to mean that you have to do something about it. It may mean that we're just asking about it, and it's an opportunity to reflect on what might be a solution or what might be a next step. Very often what I see happening is that people jump to the solution. Oh, you just have to do this. You have to go to more activities. Well, that's not always the case. We have to delve down into what's going on. For some people, it may be more connecting with yourself in order to be more socially connected with others. For other people, it may be that they don't have opportunities to connect with other people, but they want to. There's also this idea, as I started saying, I have some patients who are hearing impaired, and that makes it very difficult to connect with others. So if I don't address the hearing, it's very hard to get anything further, right? Or if someone has trouble with incontinence, they may be embarrassed to go out. So how can we do that? I will also say, in the spirit of the topic of tonight, thinking about aging, is that ageism and our acceptances of differences as we age is part of the solution as well, and addressing that we all age differently and having compassion and understanding for the different ways that we experience our lives. Some of the research that's been done looking at how we can actually address loneliness looks at 4 different categories: improving social skills, enhancing social support, increasing opportunities for social contact, or addressing maladaptive social cognition. Now, the evidence for all of these actually shows that the most evidence is actually for social cognitive training, which is this idea of cognitive behavioral therapy, or how do we get out of some of these negative thought patterns and circles in order to start to address the issue. So if we just put someone in a social group, but we haven't addressed those negative feelings, it's going to be really hard to see some improvements. I love this. This is a picture from one of my daughter's book that we asked the little fish, how are you feeling? And the fish says, I feel lonely, but then I remember that I'm loved.
this is an example of social cognitive training.
When we look at the evidence for social support and social skills, so My research group and I have studied and worked with the Curry Senior Center, which is an amazing group in the Tenderloin here in San Francisco. And what we found is when we paired older adults with a peer, someone who had a similar lived experience, over a 2-year period, the individuals had reductions in loneliness, depression, and anxiety, and felt that there were fewer barriers for them connecting. So these things actually can work. So there is evidence for programs that can work. And it's this program that we are studying or trying to study with the CDC over the next 5 years. So say your prayers that I will continue to be funded. And then there's improved opportunities for social contact. Some of this is as simple as some of the phone interventions and friendly visitor programs. And you could think about how at communities here, like at the Frank residence, is there a way to either establish peer programs or phone check-ins for folks that maybe don't have extended family or don't feel like they want to connect with others in person? How can we think about this? And then other ideas is, again, combination interventions, or the idea of community as medicine. With this amazing nonprofit in the East Bay called Open Source Wellness, what they have decided is they say community as medicine is that they have folks join together for different activities with the idea that your health can improve when you're amongst others. And what this group found is that when they had participants join in on these community programs, again, there's reductions in depression, anxiety, and loneliness. This is not pharmacology, right? These are things that are happening all around us, but being intentional of being a part. I'm going to pass that. I cannot, end this talk without talking about technology, because again, this comes up all the time. A couple of things for us to know.
In some studies in 2021, there may be some higher numbers now.
Only 61% of people over the age of 65 had a smartphone, okay? That's a good number of people, but that also means that there's many people who don't have a smartphone, which makes it difficult for many of the interventions that people are trying to create by having it be by an app or a phone. This is a busy slide, but what I want you to take away from this slide is that when you look at loneliness or feelings of loneliness or feeling of happiness, comparing in-person encounters versus phone or video, phone and video can decrease the feelings of loneliness some, but it's never the same as in person, okay? So it reminds us that while phones and videos can be a tool, it is not the every answer. So what else can we learn from our community? So I, a couple years ago, gave a talk at a community similar to this in Wisconsin. And what I asked people is, what do you think will help in your community? Sorry, I got cut off. What do you think will help address loneliness in your community? So what most people say that they wanted was having increased social access. They wanted more opportunities to engage with each other. That was the big category, okay? When I asked them, so this is what it is, they wanted more social groups, they wanted some peers, and they wanted in-person opportunities to connect with others. What people did not want more of was texting, artificial intelligence, and social robots. Do you know where all the innovation is? This, right? Because no one's asking us or asking older adults what could be helpful. So this was very funny to me. So even though there's evidence for what we could be doing, I think there's something really important to turn back to, is that when there's evidence is limited, and still, even as a physician with evidence-based medicine, there's still a point that we have to do things at the individual level. What is going to work for you? And so it's, how can I individualize to this person? How do we make sure we can talk about this topic in a way so it's not stigmatized? And how can we think creatively about solutions? When I think about what matters to the individual, so this is a picture when I was in France this summer, and this is what matters to me. I was with my godmother's son and his wife and my daughter and husband, sitting around a fireplace, just connecting in person. And that was a beautiful experience for me. My daughter in the middle loves receiving cards in the mail. And my mom, because she doesn't live in San Francisco, sends my daughter cards. And it is like the most amazing thing for my daughter to feel connected and to get this card from her grandmother. And my husband loves running and I hate running. So he goes running and connects with people on his app in terms of reinforcing their running, and that works for him. So the reason I share this is because it's very hard to think about what's going to work for all of us because we're all different. And so what works for me may be different than what works for my daughter, may be different than what works for my husband. But at the county level or at the national level, there's different initiatives. And I wanted to highlight some things from the Surgeon General's report, but also some initiatives going on around us. California Volunteers has this initiative talking about, I think it's on this one, the 6 Neighbor Pledge. And this is based on some work out of a study with Nextdoor saying that people who did 6 random acts of kindness with neighbors had increased feelings of connection. So what did we do on Thanksgiving? I forced my daughter to go ring doorbells and leave some flyers and introduce ourselves to our neighbors. My daughter loved it, and it took us out of the box a little bit to expand our neighborhoods. No one's come to say hi to us yet, but I'm a little bit hopeful. They may have thought we were a little weird, but that's okay, I'll take it. But it takes these initiatives to kind of get us back into community. So to summarize, I'm hoping that I've shared, and we'll have some more time for comments and questions, is that social connection is really vital for ourselves as individuals, but also as our greater community. It's important for us to help us feel healthy, safe, inclusive, prosperous, resilient, and ultimately, I'm hoping, civically engaged. The 6 pillars of social connection that the Surgeon General has outlined in terms of a greater view across the nation is thinking about how can we strengthen infrastructures in our communities? How do we enact pro-connection policies? How do we mobilize the healthcare sector? How do we think about our digital environments? Deepen our knowledge, which we're doing here, in building a culture of connection. So that's it. Thank you.
Okay, can everyone hear me? Awesome. Carla, that was awesome. Thank you so much for being here and for that great presentation. I wanted to start by asking you a little bit about your own career journey and what led you to focus on loneliness in older adults.
Yeah. Well, I'll start by starting a little bit further back from that, is that I was on a very different path. I was really headed towards reproductive health. But what I realized when I was in medical school, it was actually specifically on my surgical rotation, that I realized that we were treating older adults the same as younger adults, but not in a good way. And I became very interested in understanding aging. I also am an anthropologist by training, and I think my view of life is really in the context of understanding people's circumstances, their community, and their journey. And it was through that lens that I literally randomly, and I think this is how a lot of science happens, sorting through a code book in this health and retirement study, because my mentor was like, why don't you just read these questions and see if anything's interesting? And I found the UCLA loneliness questionnaire, and I thought, wow, I've never asked any of my patients about loneliness, and I've never been taught about this, and I wonder if this is actually something that's contributing to people's health. And so it was very serendipitous in which, in many ways, how science sometimes happens.
Thank you. So we titled tonight's event Social Connection as Medicine, and I wanted to, you sort of touched on this with the slides, but can you say more about what it would look like for our doctors to prescribe socialization, and also why you think healthcare professionals should start doing this when they're with their patients?
You know, that's a great question, and it's nuanced in a little bit, and I would say that I would love for all of us as clinicians to just be interested in whole people and not just diseases. And I think we all go into medical training thinking that, and then it fades away for some reason. We happen to live in a capitalistic country, if you're not aware of that. And there are financial implications. So there is a part that literally financially, for our healthcare systems, it makes sense to pay attention to connection. But I have also come to learn that, again, I see this day in and day out, that when we don't address connection, whether it's loneliness or isolation, my patients have poorer outcomes. I've seen this in the hospital settings, and Adrian and I used to work together in hospitals, but we saw it from people having longer stays in the hospital with more complications because they literally didn't have anyone to take them home. I had a patient who said, well, I missed dialysis because no one could take me. So these are these things that we see day in and day out. But I also think it matters to people. It matters to all of us, and it impacts every aspect of our health. And so in some ways, even though I don't have all the solutions all the time, if I'm just addressing, hypertension, but not addressing these other issues, well, am I actually doing something? So I think there is room for medicine to make changes, and I'm seeing it every day, actually. It's slow, but medicine is slow to change. But I think we're starting to see a new generation of physicians specifically, but all health specialties that recognize that things need to change. And I've been humbled in the last couple of years working in the hospital where I see my medical students and residents. I think I almost fell off my chair one day because the medical student was like, I think they're lonely. And I'm like, oh my God, finally someone recognizes that this is affecting people's lives. But there's a lot of things going on in the world, and I think we also know that there's a huge, crisis of burnout amongst clinicians, and so there's an important thing to say that we can't do this alone, but I do think that we're starting to get to a place where we're starting to think about how to prescribe for social connection.
That tees up my next question perfectly because so I'm an Atlantic subscriber, so I got that issue. I actually brought it tonight, the Antisocial Century, but of course I forgot it in my office. And one of the things I think that's really interesting about that magazine coming out at this time is that it was a reminder to me that, and it speaks to what you said about how everyone is an individual, right? That what makes you feel less lonely is probably different than what makes me feel less lonely, and same for your family, and same for all of us. So, how should we think about if we're entering an antisocial century? And actually, the article, you should all read it because it talks about how being at home and alone more is changing our personalities, our politics, and rewiring our brains. It's really long, but it's really good. And so I guess I'm wondering, how can we think about what we can do as individuals and what we can expect our community, and when I say community, I sort of mean like all the layers of community, this community here at Frank, and also San Francisco and America. Like, how can we, I don't know, what would you say needs to be done as individuals and also as neighborhoods and communities to reduce the prevalence of loneliness?
Yeah, so let me just solve it all tonight, so we're all
Great.
connected tomorrow. But so there's two parts, and I think, in my slides I showed a little bit about some of the evidence for individual interventions, and I think there's something really important there that we can do as individuals. But there is this very basic thing for all of us, or for me, when I'm feeling lonely, is for me to look within, right? And try to understand, like, what is that discrepancy for me? Is it because I'm in a fight with my husband? Is it because I'm not feeling connected to my, work community? Like, what is it that's driving that? And really having hard conversations about why that could be. So, and again, I think what helps us each connect feels different. I felt lucky to go to yoga last night. And actually for me, feeling more centered in myself helps me be more present for my family and my community. So having those conversations at a, societal level, I think the Surgeon General outlines it very well. It's really thinking about what policies we're creating. Happens to be a topic going on nationally right now, is how do we continue to include people and not exclude people? And if we can't focus on that, and honestly, right now, if there's one thing we should be doing, it's really refocusing our energies on creating cultures of inclusion and not exclusion. But it's anything from thinking about the built environment in our public spaces. And so as we think about these solutions, it's how do we build buildings for older adults? Are there community spaces where we can gather? If it's a new low-income housing building, are we building studios where no one can live with anyone else and they're forced to live alone? I mean, there's a lot of things that we could be doing. I don't know if I answered that.
Yeah, no, thank you. Well, then let me ask a related question. So here on campus, we have a large array of programs. We call it Life Enrichment, and but all of our Life Enrichment program seeks to bring people together either for like a shared collective experience or programs that provide a space for meaningful social connection. And so I'm wondering, because you study this, what interventions or programs have you found are particularly effective in addressing loneliness in aging populations?
Great question. I think two ways to answer that. One, making sure, and I don't want to cause any problems by any comments I make, but making sure you're asking the residents what they want and may be interested in, one. But two, actually what I find most promising and where the data is most exciting is in peer programs. And the idea that it's harder sometimes to go to an event on your own. And then this is why there's great literature on peer programs, and the idea that you have a friend, a companion, someone who doesn't have an agenda, but really might be like, hey, let's go to this program for the first time. Sometimes it's easier to do that. So that's where I'm seeing the most promising things. I also think that creating a culture where it's okay to talk about feeling disconnected is really important. So losing the stigma around loneliness and isolation.
Can you say more? We had a talk, I guess it was like 2 weeks ago, called Normalizing Aging, and one of the things Dr. Green talked about was that ageist beliefs are not only held by people who are young, but that as we age, we hold beliefs about what it is to be old. How can we like examine those so that we do make it okay to talk about feeling disconnected, and that our own ageist stigmas or stereotypes aren't getting in the way of creating peer connections or positive social connections?
Honestly, one of the biggest things you guys are doing is starting these conversations. But I do think that you're right. It's some of our own judgments towards ourselves that are creating more of the problems. I mean, we all hear that I don't want to live in a place like this because I don't want to be around old people. Well, what's wrong with getting older? And so it's changing those dialogues that way. I've seen, in some of the clinics that I've worked with before over the years, I've remarkably seen in smaller group settings, maybe not as large as this, but smaller group settings, that people are more open and likely to talk about it, especially when you self-disclose. I think, there's several authors these days and writers like Brene Brown that talk about vulnerability and the idea of expressing and sharing what you're experiencing. And I will say that, for example, it wasn't, here I am a loneliness researcher, and it was during the pandemic and being pregnant that I realized that I was incredibly lonely, but didn't kind of realize that until it was in a safe environment. I was like, wow, I think this is actually what I'm going through, and was totally oblivious to what was going on. And when you invite that about yourself, it kind of invites other people to share.
Thank you. So related question, but a little different. I'm wondering if we could address loneliness earlier in life, could that lead to long-term health benefits as people age? So, for example, we know that exercise and fitness is really good for you. It helps prevent heart disease. Are there parallel best practices that help prevent loneliness? And what is the most practical advice you give to your patients?
Long questions. So yes, and I would say that I'm ageist because I only like older patients and I don't like younger patients. But I have a 4-year-old daughter, and so I am worried about younger generations, and I am absolutely worried about the potential health effects if we don't address this crisis now. And we do have studies internationally for communities that have the largest number of centenarians and healthy aging. And what we see in those communities is connection and community. So there is evidence to show that we can actually protect our health by focusing our social connection. I will also say along those lines is that, my daughter was born in July of 2020. And doing the research that I do, my husband and I were terrified, and we made active decisions to connect with family and friends. in whatever way we could to make sure that she had social connection, and that became a norm at an early age. And we continued that. I was joking with my mom last night that during the pandemic, I was also terrified she wasn't being exposed to like viruses. And I'm like, maybe she should lick the sidewalk. Like, I don't know, to get more exposed to bugs. But so I do think there's things for that. And in terms of what, I don't know that I have specific advice to my patients directly, because I think it's not for me to tell someone what's going to be good for them. It's about a mutual discussion in terms of what could be driving this, and let's talk about different ways to address it. And that's where the key of social prescribing is, which is different than the usual physician saying, you have high blood pressure, take losartan. But it's having discussions in terms of, are you lonely? Are you worried about that? Can I share that this is impacting your health? And do you want to address it? And if so, let's talk about how we might do that. And this doesn't happen in one visit, but it may be in getting to know people that you start to do this. And that, to me, is what, medicine is about. It's about forming relationships. And usually on that first visit, I'm not going to go into all of this, but it'll take time.
I'm going to ask 2 more questions, and then I'll turn it to the audience. I want to talk about technology for a second, because studies have shown that there's a correlation between the rise in technology, particularly smartphones and social media, and the rise of loneliness. And I have an 11-year-old, so like the panic among parents is real, and we all worry. Well, what if we say no phones, but then everybody else gives their kids a phone? Then, what do we do? So my question is, meanwhile, though, before I ask the question, I also know that technology can actually expand and deepen connections. I'm sure that the relatives that you have in Mexico and Italy, technology has made it more possible for you to stay in touch with them. So what opportunities and challenges do you see in using digital tools for older adults?
Yeah, so the great question, complex question, and nuanced. Some of the slides that I didn't share is that with technology, there's a technology gap, and it falls along socioeconomic lines. And so there's huge portions of the population that are left out when we're creating things only for those that are tech-enabled. The literature is very mixed in this space, and in my national committees with the global researchers or the national researchers on this space, there's debates all the time. Is technology helpful or not? And ultimately, like many things, it depends. It depends how we're using it. If we're going to dinner with family and we are on our phone, well, that's kind of a problem. On the other hand, if we have families across states and we can't see them in person, is that a way to stay connected? And I think, as you say, I think WhatsApp has been amazing for my connections with my family and friends in Mexico, Spain, and Italy. It is not the same as when I go to Italy or Spain, potentially because I have amazing wine there as well. But there's something different. So it's really about how we're using it and being intentional about what we're doing, and are we using it as a replacement and keeping away from other social activities, and are we forgetting how to have real conversations with people? My husband and I joke that we think maybe the reason why we've had good communication over our 14 years of knowing each other is that when we first met, we had phones, but they couldn't text each other, and we don't know why. We both called our phone companies, and it just didn't work. So we actually had to pick up the phone and talk to each other. So it wasn't this smiley face, hi, I love you. It was we actually had to call. And so there's something about us forgetting how to have conversations, which gets into the maladaptive social cognition and social skills. So.
That's really helpful. Thank you. Okay, this is my last question. I see there's some adult children in the audience, and I also know that even if you're older, that you have friends that you may want to see or you worry about. So I guess I'm wondering, if you're not a doctor and you love someone who's older and maybe lonely or isolated, how can we, as somebody who cares about our parents or our friends, how can we assess if someone is lonely, and how can we encourage and support them to be more connected without infantilizing or telling them what to do?
So you start by saying, I went to this amazing talk last night and I learned all these things. There is a part of normalizing the conversation, and it's not assuming. I see so many issues with children assuming things about their parents or assuming what someone needs. I saw this during the pandemic. I had friends that call me like, should we see our parents? I said, well, have you asked what they want to do? No. I'm like, well, why don't you ask them if they want to take these risks and see you? So don't assume, ask. I think we have to be comfortable with saying like, hey, I'm worried you might be lonely. Is that possible? Did you know that that actually affects your health? Is it something you want to do about it? Is it okay to talk about? But it sometimes can be really hard as the recipient of that information because then we have to sit with that discomfort of knowing my family member, my neighbor is lonely. But I think creating space to talk about it sometimes goes a long way and not jumping to the solution. So being comfortable asking, don't assume, don't try to solve the problem if someone doesn't want you to solve it. And yeah, I think that's a good place to start.
Thank you. And I think that's a good place to begin our audience questions. So we have about, let me just check my timeline. We have about 15 minutes for audience questions. So I think Lisa is maybe has a mic, Jasmine has a mic to go around. And so is it possible to put the lights up a little bit more in the audience so I can see? Oh, that's better. Thank you, Jody.
Good morning.
Okay. Now it's bright in here. Okay, so I see a hand. Jan, wait, and Lisa, can you bring the mic to Jan so that everyone else can hear your question?
Okay, I have two questions. One, any difference between men and women in terms of this social issue? And then the other question is have you looked at the timeline? I don't know at what age you are starting this process. Is it 50, 60, 70, 80, or 90, or who knows what? And tracking the amount of decline going through this timeline.
So great questions. And I now forgot the first one. What was the first one?
Difference between men and women.
So interestingly, yes. So some of the early literature showed that there was more women than men. Now some of that data seems to be, so the early literature was that women experience more loneliness than men and men potentially more isolation. More recent data shows that there may not be as much difference than we once thought. I think the literature is changing also because we're asking the questions in a different way and more broadly, and people are becoming more comfortable asking these questions. In terms of the timeline to when we see these changes, no, we don't know, and I think that's one of the areas where we need more work in to see longitudinally, like, the hardest thing for a physician is I don't know, like, how long do you have to be lonely to start seeing these effects? Or how long do we have to be isolated? I had really hoped and tried hard during the pandemic to start studying this, but it was really hard to get the funding quickly. But we know, and I'm sure many of us people saw, people die very quickly because of isolation. I think we all saw it in our communities, but we never quantified it. And that is a big area lacking in research.
Yes, you in the front row.
Well, two things I wonder about, like, for instance, the fentanyl crisis.
Yeah.
I think that the drugs activate the pleasure centers of the brain, which is really a poor substitute for social contact. And that is why servicemen re-up for 5 tours of duty so they can be back with their buddies, because civilian life is so lonely.
I think that is a great comment, and there actually is some emerging literature, and there's some theories behind some of the substance abuse disorders and fentanyl epidemic in terms of thinking about if we address these feelings of disconnection, in addition to some other things, could we mitigate that? In the work that I do in the Tenderloin and Curry Senior Center, where there's a lot of people with coexisting substance use and mental health challenges, we again have seen that the presence of a peer has tremendous effects, and that's one of the areas that we want to study more.
Thank you. More questions? Yes, in the third row in the turquoise shirt.
Thank you. I am part of this community as the daughter of a person in memory care. And is it too soon to think about the issues of loneliness for people with dementia? Because their lives, by their disease, is shrinking, and as well as their social connections.
That is an incredibly important question and observation. There is a decent amount of literature on loneliness in people with dementia, but you can also understand that depending on the amount of dementia, it can be hard to get good measures and quality in terms of what's going on. I will also say related to this is that loneliness usually can also be episodic, right? So I had some really rough times during the pandemic, things got better, and then depending on what's going on in my life, they go up and down. And it's similar with dementia, that if you get someone in a good day, they might be able to express it more. But I think your question is relevant for two reasons. Again, it's polypharmacy in folks with dementia. We also know, not in dementia, but we also know that loneliness and isolation severely increase in the last 6 months of life. Why is that? A couple things can happen. The person may be withdrawing, but society withdraws from the dying person as well, and the discomfort with aging and dying. And so how can we think about that? It's incumbent upon us as daughters, as community members, to figure out how do we help people feel connected, whether it's helping someone remember what they used to like or engage in a different way, but that's where it becomes challenging to know for the individual person what that means. And not assuming what that person needs, but trying different things to make it work.
Kathy? Oh, wait for the mic, please. Front row.
Oh,
Thank you. I'm interested to know how your colleagues, other doctors, and UCSF are dealing with your challenge. Could you imagine that, how would you introduce this into the medical curriculum? At what point and around what kind of courses, and what kind of resistance would you have? I mean, when I listen to you, it seems like talking about hypertension or inflammation would be entry points, but I imagine that you probably get a lot of poo-poo about this is not a serious concern.
Yes, and yes, and yes to all that. Get a lot of poo-poo, but I think the tides are changing, and I'm seeing it more. And so the work that I do locally is on one level, and then there's work nationally to really talk about introducing it to medical curriculum. A lot of medical training these days, early on, is on presenting cases. And so when you create stories, that creates more opportunities to think about what are the factors that affect people's health. That's kind of on the educational front. But I honestly think the generation of doctors that are coming through, or healthcare professionals, I'd like to think are more socially minded, or maybe I'm just biased here in California, where this is kind of, we also we have young students that are experiencing this themselves. And so that personal experience allows them to be more open about it, what they see in their patients. Structurally, at UCSF, we built in these questionnaires into our electronic medical record. It is part of the geriatrics emergency department screening to look at if someone's experiencing loneliness and isolation. And it was actually in the Institute of Medicine report, what year was that actually recommended including questions on social connection in the electronic medical record. So this is not new, we're just slow adopters. The biggest barriers we get is that we have no time. It's true we don't have time, but we're also prioritizing the wrong things. And so we will get there, but I think there's this fear that you have to solve it all. And as I stated, even with what you were asking in terms of what do you do as the adult child, it is very uncomfortable to have someone tell you that they are lonely and to feel powerless. But it is also uncomfortable to have someone come to the emergency room to say, I don't have food, or I am being physically assaulted. But we don't shy away from asking those things, and those impact people's health. So there's a part of normalizing it. I will say that in addition to feeling like we don't know what to do, and the time issue, there is also this fear of over-medicalizing, which I think is a real thing. There was already someone that was like, they're going to develop a pill. I'm like, for God's sakes, that's the last thing we need is another pill to address loneliness. But, how do we say this impacts your health without saying there's something wrong with you if you don't, have a community or you don't feel connected?
Ed.
I'm going to give you some observation-based comments. I use UCSF. I love my PDP. And I know that every time I go on my chart and I initiate a visit, I'm asked digitally all sorts of questions. My PDP has never, ever, I love her, but she's never, ever asked me, are you lonely? How often do you socialize? So you may think that you're getting some valuable information digitally. I'm suggesting that you tell your colleagues to ask us. That's it.
I appreciate that, and I agree. And it's interesting because in response to that, as a researcher, I love data and questionnaires, right? But as a human being, I hate them. I don't like those questions that I get, and in fact, I ignore them. So, I probably drive my primary care doctor nuts because I don't want to answer those questionnaires digitally. And we have a long way to go. And, my sharing some of the steps that we've taken is one just step. And there's a lot still to be done. And I appreciate your comments and observations.
Esther, you'll be our last question. I hope it's a good one.
It's a very good one. We have a big variety of people living here with many varied interests, and we have a lot of activities. But the one that seems to draw the most interest, especially in the last 2 weeks, is the current events discussion, because we get to vent, and it's not really against each other, it's against the other. And I think that's very healthy. But can you suggest any other group activities that we could suggest to Jeffrey that would get the juices flowing?
Oh man, that's a hard one. That's kind of the antithesis of what I should be doing, because I can't tell you what's going to matter to all of you. I think instead it's you all joining together and deciding what might be different things, because I do actually think, that being said, I have seen in some communities kind of either an open forum, either in a discussion or a group wall of posting and having discussions around what helps you feel connected, what helps you feel disconnected, and you find commonalities in those ways of expression. And whether you do that anonymously on a board and then come together with discussion, I think it's incredibly it also gives an opportunity to vent or to let it out and to have discussions about what's going on, because there's a lot of heterogeneity and differences in aging, yet there's also some common experiences that you can get together around to discuss.
Something tells me that the resident council is going to have a new project to work on. February 5th at what time? 12:30. For those of you who live here, show up in Zayteam, and there will be a discussion where you could share your ideas. Thank you, Kathy. So I'm going to close us out. A couple of announcements. Outside of the door, there will be snacks and drinks. Carla will stay to chit-chat with some of you. So if you want, and you should chit-chat with each other because we're here to be more socially connected. So stay and schmooze. And first, I want to thank Dr. Personotto for your wisdom, experience, and perspective. You've given us so much to think about. A round of applause, very well deserved. We deeply appreciate you being here. I want to also thank our donors because this is one of the ways that we are able to offer these wonderful programs. And so I especially want to call out the Julian S. Davis Lectureship Fund for supporting these speaker events. Thank you. More applause. And to our audience, your thoughtful questions and engagement makes gatherings like these very special. If tonight's discussion has moved you, I would encourage you to support our work in whatever way feels meaningful to you, whether through a donation, volunteering, or sharing what you've learned here tonight with others. To that point, this talk has been recorded, and we will be sharing the recording link with you in the coming week, so you can share it with others who couldn't be here. So enjoy some light bites and good conversation, and we look forward to seeing you again soon. Thank you.